Welcome to Healthcare Quality and Risk Matters. Wondering about patient safety, quality, and risk management, but aren't sure who to ask or were afraid to ask? Well, you're in the right place. We've created a safe and judgment-free space to explore these critical topics to leave you informed and inspired to make a positive impact on healthcare. So, let's learn and grow together because healthcare matters.
And we are
live.
live.
We are live. Well, good afternoon, everyone, and welcome to Healthcare Quality and Risk Matters. This is the place where you can learn everything you want to know about healthcare, but we're afraid to ask. It's our goal that we can help patient outcomes, to advance the healthcare industry, and to be able to demonstrate how healthcare quality and risk can make a real difference with healthcare revenues, but also just progressing their programs forward. So I just want to thank everybody for joining us today. I'm excited to be here. My name is Gary Bierc. I am the CEO of Aperitisoft Healthcare. I've got over 40 years experience in risk management. I am not your healthcare expert, but I am joined by three today. So I'm excited that we can continue with this. With me is my colleague, Rob Santamoor. He's our Chief Operating Officer. Rob's got 19 years experience in healthcare. Half of that he has spent in the quality and risk space, and the other half was actually bedside. So Rob gives us a great perspective on healthcare quality and risk. Also, Rob has an MBA. No, do you not, Rob? No, you're an RN, correct, Rob?
I'm an RN, yep.
That's correct.
Yep.
And then we're joined by Dr. Timothy Brown, who does have an MBA.
Yes,
and
correct.
he's also a PhD in healthcare administration. Timothy, you've got 15 years experience in healthcare in all kinds of different areas of a hospital operation, correct?
That's correct.
Timothy gives that great perspective on how hospitals are run and how they might see various risks and even how quality may be important to them. But Timothy, we have a special guest today. I'd like you to introduce our special guest, Dr. Dan Diamond.
Absolutely. I'm thrilled to have my good friend and colleague, Dr. Dan Diamond, with us. He is an experienced family physician and an award-winning educator. He's internationally known throughout for just the work that he has done extensively with his background in medical triage. Dr. Diamond has also served as the director of the medical triage at the New Orleans Convention Center during Hurricane Katrina. Very well known. I do have his book I do want to just share as well. If you are a book reader like I am, love reading this particular book, Beyond Resilience. It is available on his website and also on Amazon if you're one of those that like to jump through Amazon. But without further ado, I would like to introduce Dr. Dan Diamond today. Thanks for joining us.
Welcome, Dan. Welcome to our show today. Our theme for today is patient safety equals good business. We are commemorating Patient Safety Week. We've been dedicating our entire month as a company to patient safety and how we're doing our posts. So that is going to be a theme. Now, if you're here for the first time, we have a very simple format. We begin with the incident of the month, and then we dive into something we call Minute Matters, where each one of us can ask any one of us a question, and we have only 1 minute to answer that question. Please, while you're watching, if you've got ideas, questions, comments, please dive into the chat and let us know what you're thinking, and we'll try to incorporate that into our show today. So let's begin with the incident of the month. What do we have going on today? Rob?
Well, unfortunately, searching social media and the general media outlets, there were way too many articles to choose from surrounding patient safety, things making the news. I randomly picked one that I thought would be catchy. There's catching a lot of eyes, awareness to patient safety, and it was a New England hospital not that long ago that, due to some maybe not best practice, some unsafe IV practice, 450 of their endo patients, there's ended up being potentially exposed to HIV, hepatitis, and to the point where the risk was high enough where they were required to do notification to all of those patients. It made the news. And of course, information like that is detrimental to the community because of the fear that it creates in their access to healthcare. I'm happy to report, though, that nobody has popped positive for any of those things. But the fact that risk was still there and that there was that patient safety concern across a 2-year period was a little alarming to see on the media outlet.
So let me ask a question, Rob. What was the hospital's response to all this?
That the risk was low. I think that they said that the risk was extremely low, was the way that they quoted it. From my perspective and my experience, I don't love that answer, right? The answer of saying, well, it was a low risk. That doesn't speak to really good patient safety. There's in the way that it lands on my ears, really good patient safety is this was a risk, and that was detrimental to our healthcare organization and our community. We are going to take strong, swift action to make sure that we are meeting best practice or exceeding that every time moving forward. There's not, nothing bad happened, so I guess we're good. Right?
Well, okay, since we're a safe space, Dan, you've got to weigh in on this. What do you think about a hospital whose answer to this problem is, don't worry about it, it's a low risk?
Yeah, I want to go back to what was going on with the staff that this was even possible as a risk. You know, I've worked with people that are just punching in, you know. I've worked with people that said out loud, I'm just here for the paycheck. I'm like, seriously? You're just here for the paycheck? That's going to kind of set us all up for some trouble potentially. So that's the first thing I'm looking at is what was going on in the infrastructure that made this even possible in the first place. What was going on with their team dynamics, what was going on with the organizational dynamics, and maybe most importantly, what was going on within the people that were on that team and how they showed up. Because that stuff starts here.
That's good.
I love your immediate perspective of talking about the system failure, right? There's what did the organizational infrastructure of leadership, quality, compliance, there's risk, there's set a tone for, set a standard for. There's what doors did we leave open that let those risks go through for so many months, almost 2 years. And I do believe that starts with the right infrastructure, the right resources, and the right leadership. There's ensuring that the people that are there for just a paycheck, there's have an ability to reframe of why they're there. And if they don't choose to reframe, and that's not what they want to do, then maybe help them relocate to something else where they're not patient facing, right? And but I do believe that setting organizations up with the strong enough infrastructure and quality, risk, compliance, and leadership, is what ensures patient safety.
Rob, can I throw something back at you?
I would love that.
I'll be the contrarian to say I believe enthusiastically that words matter, and the word infrastructure feels cold like the framework of a building to me. What I'm talking about is different than the infrastructure, which kind of smells like org chart to me. I'm talking about what's the environment like when you come to work? What's the environment like in here? Yeah. And how do I show up? How do I interact with my team? There's a difference in the teams that I've been on where people are connected at the head versus the people that are connected here. The ones that go, I got you. I know you're having a tough day. I care about you. I'm willing to speak up. But that stuff comes sometimes deeper than an infrastructure thing.
Right, the words that I would associate, Dan, where you're going with this is tone, culture.
Yeah.
And in any organization, and I'm not the healthcare guy, but I have had an experience in the corporate world where it was spectacular. It was exactly like what you're talking about. You knew you had the back of the leadership of the team, and everybody was marching in step to get the mission done. What a wonderful experience to have had in my career. But when you think about healthcare today, you would think, again, this is me, throwing this out. You would think that number one is patient safety, number one, and that everything would emanate from that because that's the business that a hospital or healthcare facility is in. Am I right, Timothy? Am I off
You,
base with this?
you're absolutely right. I will say this, on paper, I think 99% of healthcare organizations have somewhere where patient safety is first. When we get to what Dan is speaking to, where we have that internal versus external culture, you have what's going on internally with that individual person that may be working in that department versus the department culture versus the organizational culture. Those
Mm-hmm.
are three different layers that we have to infiltrate, if you want to, or penetrate in order for us to really get down to the heart of the person that's working on our patients. So if that person is clocking in saying, I'm just here for the paycheck, you have to think there are three different layers we have to get through: organizational, department, individual. And if you're not connecting on all three of those layers each and every day, then you run the risk of patient safety being your motto, but your actual outcomes not necessarily aligning with that overall motto.
There's also
Okay, well,
the
let's
idea of
pivot to
psychological
Minute
safety.
Matters, Rob. Let's pivot to Minute Matters on that note. I guess that's the way to think of it. Dan, remember, you got 1 minute to answer questions, and we're going to put you on the hot seat first.
All right.
Timothy, since he is your special friend and guest, I'm going to ask you to ask the first question of Dr. Dan Diamond.
Well, here's the beauty. I'll stay right there within that overall fostering a culture of safety. Dan, the question for you is, what role does fostering a culture of safety play in enhancing employee satisfaction and possibly retention? And how does that translate into a positive impact on the bottom line for healthcare businesses?
Yeah, I just think about the times when I've been deployed into disasters. We have a big roster of people that are on the team, but we don't know who we're going to actually be deployed with until we get to the airport. And almost always it's people I don't even know, never met them before. My go-to philosophy is I'm going to make 3 major mistakes during this deployment. I would appreciate if you tell me before I blow my leg off. That sets the tone of, Diamond is the team captain, but he wants my input. And if I don't create psychological safety on my team and give them permission and request from them input when I make mistakes, I'm setting myself up to do really dumb stuff. And I would rather find out before I do the dumb stuff, but I have to give them permission and invite them in.
5 seconds, Dan.
That's awesome.
Good job, Dan. You got it in there. Rob, you fire your question off at Dr. Diamond.
I want to thank you for that reframing of that infrastructure, and I think that makes so much sense. And I know this isn't a question yet, but yes, I think that makes a lot of sense. There's to talk about it being truly the heart of healthcare being patient safety. There's rather than the people that are just checking the boxes mentally. And that does reframe it. That does mean that we're doing the right things for the right reasons, and that's how we get to patient safety. And so my question for you would be, how do we set up an organization to do that, where we are teaching, and I know Timothy alluded to it a bit, there's to be there for the right reasons and do the right things for the right reasons to protect our patients?
I think inviting people into the conversation. The old model of leadership, which is, I think, dead and not worth resuscitating, by the way, is, a few people having the answers. It's the command and control. The doctor's right. Yeah, sometimes I'm not. I think a better model of leadership is inviting the voices of many different people in and asking better questions. When I was a resident, they told me the most powerful person in the hospital was the unit clerk. But they never said, you should ask the unit clerk what she thinks. It was just treat her with respect, be nice to her, but she was never invited into the conversation. And fairly good chance she had some ideas on how to make this
10
culture
seconds.
safer.
Mm-hmm. That's good.
I can end right now. Boom, 5 seconds.
I fully agree with that. We do not
That's
bring the
good.
right people to the table too often. We leave out the people that there's phenomenal insight. There's impactful. There's processes within the hospital that, transporters, right? We leave transporters out of conversations. That's involved in moving patients from
So
the
true.
OR to the ICU. Why are we not engaging the transporter? That is a
Yeah.
huge part of it, right? So I fully agree. Inviting the unit secretary, and I was a nurse for a long time. Yes, the unit secretary is the most powerful person in the hospital. You are absolutely right. I couldn't agree more.
But there's a difference between don't make her angry and invite her into the conversation.
There it is.
Ask
Huge
her
difference.
opinion. Give her a voice.
Huge difference.
Yeah.
Yep.
Yes.
So Dan, you get the privilege of putting one of us on the hot seat now.
Yeah, I would say, Timothy, I'm going to be bold, okay?
Okay, sure
You
thing.
and I have known each other for a long time.
We have.
And I'm going to go into a dangerous place with my question. As you know, I have a passion for breaking down racial barriers.
Mm-hmm.
And there's some data that shows that people that are bicultural are actually better problem solvers.
Wow.
Because they can switch from one viewpoint to the other viewpoint. So I'm thinking when we're looking at patient safety, how do we make sure that it's not just a group of white people or a group of black people on the committee, but we're inviting a variety of different cultural backgrounds into the committee? How do we do that?
That is a great question, and I'm glad you brought this question up. It's one that I've worked with a number of years within diversity, equity, and inclusion. How do you have the right people at the table making the right decisions for your population? One of the biggest things I've always said is your board, whoever your executive board that you're governing, the different organizations that you're governing, the community that you're governing, should be a reflection of the community that you're governing. So I look at the populations that are available. If you're looking at one area that may be 40% African American population, 30% Caucasian, your board should also reflect that. But also the voice should be open. You should still invite the community in. And I think there's a reoccurring thing that we have on all of our podcasts, all of our LinkedIn Lives, is there needs to be consistency with the right people at the table. How do you identify the right people? You have to ask. You have to be open to communication. You have to listen more than you're actually talking. And when those decisions are made, you need to
10
bring that back
seconds.
to the organization, to the community, so that they have a well understanding of how to move forward with you.
And what an amazing way to support patient safety in all of the healthcare disparities that we know exist. When we have all the right people and representation, ideas, as you're saying, Dr. Diamond, the right brains at the table, right?
Correct.
And I think that is very important to ensure that those disparities close.
And the right hearts at the table.
Right heart, yes.
You got to bring both. I think there's a difference between diversity, inclusion, and just being a box to check versus an opportunity for hearts to connect. And if we really want to impact patient safety and take it to the next level, I believe it has to start down here.
When I think of diversity too, it shouldn't just be racial lines. There are different backgrounds. People come from different places.
So true.
That give them a unique perspective in life.
Yeah.
And we really need to hear those voices, because often they're bringing clarity to where it was very foggy.
That's true.
And that's critical, particularly when you're dealing with such a human thing such as patient safety. It's about people walking into a hospital and feeling confident in the environment that they're going to be safe there.
That's true.
So with that, I think we're going to give you the last word, Dan.
Oh, the last word.
You get a chance to opine from your guru seat.
Yeah, I mean, I have a model because my brain thinks in models.
Mhm.
So if it's okay, I'd like to share with you a model that kind of wraps
Absolutely.
this stuff
Mhm.
all up. Let's see if my technology works here. There we go. I think a lot of people are having the conversation of how do we get our employees to be more engaged? How do we get our disengaged employees to be more engaged?
Mhm.
And I think we need to ask a better question than that. The question I think is, how do we get people to be invested? It's a whole different thing when we're talking about how do we get people to be invested in patient safety? And then I'm thinking, and we talked about this briefly, how do I take care of myself? How do I
Mhm.
take care of my team? And then how do I become invested in cross team activities and communication and care? We can go one notch higher than that, even, and say, how do we get people in our healthcare organizations to start taking ownership?
Love it.
There's also
Mhm.
these guys down here, the saboteurs that are in trouble. What do these people say? How do you recognize them? Well, the saboteurs are saying, I hate my job. And they're trying to recruit other people to stay the same. The disengaged are the ones that we've been talking about. I'm just here for the paycheck. And the engaged are saying, I'm just doing my job. Seriously, that's the goal. Let's
Mhm.
just get our people to say, I'm doing my job, really. The invested people are saying, I love my team. And the owners are saying, I'm the one that's responsible. The tipping point happens between when you're looking at motivation. The people that are below the line are the takers that are saying, it's all about me. And the people above the line are the givers. So when I look at the impact, the people at the bottom are caustic and can really mess up an organization. And the people at the top can have a huge impact on making it a great organization and a safer organization. 53%, and this is pre-COVID numbers, by the way, 53% are disengaged, 13% in the corporate world, not healthcare, in the corporate world are saboteurs. That's 66%, if I'm doing my math right here, that are significantly below the line. So that's the kind of stuff I'm thinking is, how do we get people to start moving up, becoming invested in the work, taking ownership in the work, and transforming the healthcare system that we have so we have a safer place for all of us.
I love that. Thank you for saying that. Owning
That's amazing.
patient safety. There's owning that is just um, that is a very important thing to say. Thank you. It's also
Very
refreshing
well
to
said,
hear
Dan. Very well said.
physicians and hospital leaders to speak that way. I think is just phenomenal.
Yeah.
And I think that the movement toward that is what is going to increase patient safety, patient outcomes. There's in better patient outcomes, better revenue, right? Patient safety is good business.
Oh,
There's
yeah.
and that's why people choose to go to healthcare facilities. People know they have the right to choose where they go. That's why they're choosing your organization for electives and non-urgents. That's where you're making your money. There's so when our leaders start to reframe and say our patients do come first, the money will follow.
It's an interesting thing and this is just a little aside, but it's an important one. My wife is disabled and recently injured her leg and had to go to the wound clinic twice a week for months. We got the best care ever at
Awesome.
that wound clinic. And I believe that I understand why. And I shared this with them. When we come into that clinic, it's obvious that they love each other.
Mm.
And from that, they also reach out and they love us too. They care about us as people, but they're also caring about each other. If you don't have that love in your team, it's really hard to have a vibrant, engaged, invested culture where people take ownership.
And if you bring this back to our theme, that's good business.
Yeah,
Mhm.
for
It's
Great
good
sure.
business.
business.
Yeah.
That's why many entrepreneurial ventures often are a lot more fun. People are willing to work hard for less.
Mhm.
Why? Because they feel like they're all in it together
Yeah.
Mhm.
and they're willing to go after it. And they know the rewards are out there, but the real rewards happening in the building of the progress towards the end goal.
I think we're
Absolutely.
seeing a shift though. A lot of the organizations that I'm working with now are getting this. They're starting to understand we need to bring our people into the conversation. We need to connect them at the heart and the head. And when we do that, it can be a transformational experience for an organization. It's been really cool to see some teams come alive.
Well,
Now, Rob, I think we've got a bunch of questions out there. I'm sure a lot of them for Dr. Diamond. Why don't we dive in and see if we can get responses to that?
We have a lot of statements that are in support of a lot of the communication that has been shared today. There's using the collective brain power of the organization. There was a shout out to that. Looks like experiential perspective is as important. There's as ethnicity perspective was another user. And so it seems like a lot of the comments that are coming in are in high agreement of what we're communicating. There's not so much questions, which I'm really loving that there's like-minded, there's people, and especially when the like-minded is toward the concept of safety, right? We're open to thinking differently so that we can be innovative and intelligent and move forward. But we are all, at least all of us right here on this conversation and the ones joining us, there's clearly have it within our heart to steal from you, Dr. Diamond. That patient safety is a priority and that it really does mean good business.
There's something that I wouldn't mind bringing into this mix, because we're talking about culture, we're talking about tone. How do we best equip, and I'll throw this question out to you, Timothy, how do we best equip people technologically to help to fulfill a lot of what we're talking about today, culture and tone?
I always say it goes back to the numbers. So if you're like me, I'm a heavy data person when it comes down to understanding how we move forward to help support the whatever moves that are made for an organization. So those technologies that you have, you need them to be able to track whatever your incidences are for your organization. You need them to be able to document what's going on step by step. How are you correcting those overall actions as you're moving forward? And presenting that information to not only your teams individually, but also your leadership teams as they're making those decisions for the organization. So whatever technology you're using, I have one that's super awesome. Give me a call. We definitely can talk about it. But however you want to track that for your organization, it needs to be something that's easily understandable and can be tracked day to day, month to month, year to year as you're moving forward to make any decision for the organization.
Don't you think, Timothy, it also needs to empower the idea that you're safe in reporting the incident?
Absolutely.
Yes.
It needs to be open to your community. So when you say empowering those decisions, I can tell you of every person that has ever visited a hospital, you have that one hospital in your community that no one wants to go to. We all could probably smirk because we know that one hospital in our individual communities. Why is that? We know what's going on at that hospital. Maybe there's an incident that happened from a family member, a story that was told of that hospital, some type of data that was put out about that hospital that makes you feel unsafe. So using that same understanding, how do we get organizations to share the positives, the things that are helping to bring patients in and make them feel safe so that when they come to your organization, you know that you're going to get the best quality care, similar to the story that Dan told with him and his wife as well.
We have two perfect comments. Data tells and sells. I completely agree with you. There's in just culture. Just culture is absolutely right in line with psychological safety that Dr. Diamond and Dr. Brown both talked about here. And it does open up the ability for your frontline team members, those that are impacting patients, that maybe feel that power differential and they're worried about reporting. When you have an organization of just culture, you have the ability to document things that aren't going well or ideas to improve without fear of reprisal. So just culture is absolutely important for the psychological safety of the team members that are then advocating for the patient safety because they've owned it, like Dr. Diamond was talking about.
So, Dr. Diamond, I'm not the healthcare guy. What is just culture?
I was just sitting here thinking, how vulnerable do I want to be with you guys? Have you ever had this experience where you thought you knew what a word meant, and then you discovered that your entire life you had the wrong definition. That happened to me in the last, I would say, 3 years, and even more so over the last 2. This idea of justice, because I always thought it meant you do something wrong, it's justice is you get punished. You get the consequences of your screw up. Justice is served when you experience the consequences. Now I understand that just culture is about making sure that everyone's invited and everyone has a voice. And that's a different thing. I think about the poor and the vulnerable in our communities, and I think about the poor and the vulnerable within our organizations from an org chart perspective. And man, I remember Elaine Couture with Providence in Spokane. I was sitting in the back. I was speaking at their organization. I got there the day before. She was doing her opening keynote. And I know exactly where I was sitting. She said, if we can't figure out how to do this healthcare system thing, we need to get out of the healthcare business and figure out a different way to serve the poor and the vulnerable in our communities. I about fell off my chair. I'm not saying the answer is to get out of healthcare. I think the answer is, how do we give the poor and the vulnerable a voice and invite them into the conversation and respect them as belonging? And from an org chart perspective, there are people in the org chart that are not poor and not vulnerable. And there are people that are poor and vulnerable within the organization. How do we invite them in and create a safe place? So that's my new understanding of what a just culture is about.
You said that so much better, and I'm going to steal a lot of that, just so you know. There was a LinkedIn user that I just tagged in there that said just culture levels the playing field for systems and individuals.
Yeah, exactly.
That would be more like how I would describe it. I loved the level of detail you just put into that, because it really helped bring it to life as to what it really means for an organization. Because it is the ability to report without reprisal. It is a system that says I'm going to report in the best interest of my organization, my patients, in my facility. It shifts the accountability to the organization. To ensure that there are the right supports. Instead of the individual's error.
Yeah.
Now we're way over time, guys.
We are.
Are there any other questions that we can do a last question answer to that you can see, Rob?
It looks like all of the questions we have answered, at least in our last few minutes of conversation. There's a lot of additional shout outs around just culture. Thank you.
Absolutely.
If there are any last minute ones, we will be responding on LinkedIn itself. There's 20 new comments that pop up as people choose to watch this later. Getting back from lunch, right? Sit down, get to chill, watch the podcast.
Absolutely.
That's true.
Heartfelt thanks to you, Dr. Diamond. Thank you so much for sharing your time with us today. I know you're a busy man, but it was an invaluable experience. At least I felt so. For those who are following us, if you recall, last week we delved into proactive versus reactive risk. This month we got into how patient safety equals good business. And then next month, we're going to get into something completely different. We're looking at cybersecurity and how that affects healthcare. So tune in next month, the last Wednesday of the month. We'll look forward to you joining us again. Thank you all for being here, and we'll see you next month.
Absolutely.
Thank you, everybody.
Take care, everyone.